The Glasgow Coma Scale, or GCS, is a tool used to evaluate a person's level of consciousness. Today, we are going to show you a practical way to perform the GCS examination. The Glasgow Coma Scale is divided into 3 components. First of all, we check what their eyes are seeing, that is E. After that, we evaluate what they are saying, which is the verbal response, V. And what they can do with their muscles, the motor response, that is M. Each component is split into different responses. There are 4 for eyes, 5 for verbal, and 6 for the motor score. You must remember that the normal response is the highest and the lowest is no response. Furthermore, the best total that you can achieve is 15. And the lowest is 3, not 0, never 0. Now we will go through a step-by-step guide to assessing each component, along with practical tips. The eye response component of the GCS is scored from 4 to 1. It evaluates how well a patient can open their eyes. To assess eye response, start by observing if the patient's eyes open spontaneously. The patient may already be sitting up with eyes open. If that is the case, score 4. If the eyes do not open on their own, use a verbal stimulus, such as calling the patient's name. If the eyes open in response to sound, score 3. If there is no response to sound, apply a gentle pressure stimulus, such as pressing on the patient's fingertip for at least 10 seconds. If the eyes open in response to pressure, score 2. Remember, it should be a gentle pressure and not painful, as the aim is not to harm the patient. If the eyes do not open at all, score 1. Next, we'll review evaluating verbal response. The verbal response component of the GCS is scored from 5 to 1. It assesses a patient's ability to speak and respond verbally. To evaluate verbal response, start by asking the patient simple questions, such as their name, where they are, and what month is it. If the patient gets all of that right, then they are fully orientated. Score 5. If the patient is unable to answer these questions, but talks in phrases or relatively complete sentences, then mark them as confused. In this case, score 4. If the patient is unable to speak in sentences and uses just random words, most commonly they'll be swearing. Score 3. If the patient makes incomprehensible sounds such as groans or moans. Score 2. If there is no verbal response at all, score 1. Now let's try understanding motor response. The motor response component of the GCS is scored from 6 to 1. It examines a patient's ability to move and respond to commands. To assess motor response, start by asking the patient to follow simple commands, like asking to squeeze your fingers or showing their tongue. If the patient follows commands, score 6. If they do not respond to commands, apply a central stimulus such as a trapezius pinch for 10 seconds. If that doesn't elicit any response, go to the supraorbital notch and apply gentle pressure with your thumb, again for at least 10 seconds. If the patient localizes to pain by reaching towards the stimulus that is up and above the shoulder, score 5. If they try to localize the stimulus by flexing but cannot reach above the shoulder and drop their hand, this is normal flexion, so the score is 4. If they move their arm across the midline, then that is abnormal flexion, in this case score 3. If the patient shows extension of limbs of pressure stimulus, then their motor score is 2. And lastly, if there is no motor response, score is 1. Now here are some practical tips to help you master the process. First, Always use a consistent method for assessing each component. This ensures that your results are reliable and comparable over time. Second, be patient and give the patient time to respond. Some patients may take longer to react, especially if they're in pain or confused. Finally, practice regularly to build your confidence and skills. The more you practice, the more comfortable you will become with the GCS assessment process. GCS assessment can be challenging, especially in critical situations. One common challenge is assessing patients who are intubated or have facial injuries. In these cases, verbal response may not be testable, so write "not testable." Another challenge is dealing with unresponsive patients. If the patient does not respond to any stimuli, ensure that you have applied the stimuli correctly and consistently for at least 10 seconds. Patients with pre-existing conditions, such as dementia or developmental disabilities, may also present challenges. In these cases, use your clinical judgment and consider the patient's baseline level of function. Mastering the GCS requires practice, attention to detail, and a thorough understanding of each component. By following the guidelines and tips provided in this guide, medical professionals can improve their GCS assessment skills and contribute to better patient outcomes.